How to recover from a concussion. We're going to talk about steps that are needed to recover from a concussion. The very first one is to say, have you truly suffered from a concussion? Once we cover that, we're then going to go into what happens in the brain following a concussion and why it's important to use a comprehensive plan and not a one-trick pony. So the very first thing we're going to do is I'm going to share my screen and we're going to review some research. So this is from the American Congress of Rehabilitative Medicine, and this is the diagnostic criteria for a mild traumatic brain injury, as well as concussion can be used for this as well. So number one, we have to say, is there a plausible mechanism of injury? So this could be from a slip and fall, a hit to the head, a blow to the torso that causes a whiplash mechanism, a blast explosion, and other things like that. So that has to be there no matter what. Once again, you do not have to hit your head to have a concussion though. Number two, are there clinical signs? This doesn't necessarily have to be there, but these would be you take a concussion and you're confused, you're slurring your speech, you have difficulty walking following that injury. That would meet criteria. So that and the mechanism alone would be a concussion or a mild traumatic brain injury. Now, if that's not there, you can have number 3 and 4. So acute symptoms, this can be a headache, dizziness, blurry vision, light sensitivity, noise sensitivity, mood changes, and other things like that. Number 4 is going to be the clinical examination, and that's going to be eye movement testing, balance testing, and cognitive testing is what's really the gold standard. Now, this doesn't require you to actually struggle with your eye movement testing per se. Even a symptom increase when doing the testing would be sufficient when comboed with criteria number 3. Now, this should not be better explained by something else. So something else would be like, okay, you've been intoxicated, right? You've got schizophrenia, you've got medication side effects. So it's got to be something that better, that doesn't better explain it. And that's how we make the diagnosis. Now that we understand, okay, you've got the diagnosis, we've got to understand like what's happening. Okay. When we go old school, right, and we look at the world of brain injury, I've been doing this work for 10 years, and I was trained from people that have been doing this work for several decades now. And we were rehabbing the brain. We were using high-level eye movement-based therapies to target parts of the brain. We were using vestibular therapy, sensory stimulation, nutritional supplements, and other things like that. And we were told we were crazy because at that point in time, the care for concussions was go sit in a dark room, don't do anything. And then if you magically get better, awesome, keep going on with your life. Now, all of a sudden, most clinics are doing some level of vestibular and oculomotor therapy. Now, that should no longer be considered acceptable because of what we know of concussions. So from the time you have an impact, you get a cascade of events that are going to occur. And this can be more of a cellular level. So you get penetration of the blood-brain barrier. You end up with inflammation in the brain. You also end up with this energy imbalance, mitochondrial dysfunction. So your mitochondria actually produce energy. We also get changes in our cerebral blood flow and getting blood to the tissues that are needed. This is believed to be more short-term, even though there's some research that shows, hey, this actually goes up to a year. So when we're looking at this, we have to say, okay, you know what? If these are things that we know that are happening, this can be part of the reason why so many people are not recovering from a concussion. Hint, this is not all going to be addressed if you do physical therapy and all you do is physical exercise, okay? This isn't going to be done if you work on neck pain. This isn't going to be addressed if you do cognitive rest. This isn't going to be addressed purely from sleep. This isn't going to be addressed purely by addressing gait problems, dizziness and vertigo, vestibular-based issues. Now, that's not to say everything I've listed isn't something good, but it is to say it's incomplete. So what does the highest level of concussion recovery look like, in my opinion? The highest level is going to help you identify how your brain is currently functioning. That's going to be done using eye movement testing, balance testing, cognitive testing, and probably even brainwave testing to let you know how different parts of the brain are communicating. The next is to understand what would prevent the brain from functioning at the highest level. Sleep, stress, what's your blood sugar like? Where are your hormones? What about your thyroid? What about vitamin D? What about your nutrition and other things like that? And then there should be a plan that is going to go after what is found there, but also go after inflammation, cellular energy imbalance, and mitochondrial dysfunction. This can be done through how you eat. This can be done through exercise. This can be done through sleep. This also can be done through specific targeted nutritional supplements. And then it can also be done using stronger things than that, such as peptides. So as you see, we've evolved from brain injury, don't do anything, to brain injury, let's do some generic physical therapy, to brain injury, now let's do some generic vestibular and oculomotor therapy, to brain injury. Hey, you know what? All of that, but we also have to address what's happening underlying within the immune system in the brain, the mitochondria, as well as what's happening in the body that prevents someone from getting better. What I've found over the years is as I've added these layers together, I've helped harder and harder cases get better that previously weren't, but also the cases that were getting better, they are now recovering faster than they were before. So let me know what you think. What questions do you have? This is how you recover from a brain injury, is by using these steps. Until next time, this is Dr. Z.